We live in a world where stress is everywhere, and it's making people sick. Adjustment disorders, burnout, exhaustion, these aren't rare diagnoses anymore. They're among the top reasons for long-term sick leave, especially in countries like Sweden. But what's the best way to treat stress-related disorders? A new study set out to answer that question by comparing two different online treatments, both guided by real therapists. One was cognitive behavioral therapy, or CBT. The other, a general health-focused program called GHP, offering lifestyle advice and self-care tools. Here's how the study worked. 300 adults diagnosed with adjustment disorder or exhaustion disorder were randomly assigned to 12 weeks of either CBT or GHP, both fully online. They measured stress levels, burnout, anxiety, sleep, quality of life, and more before treatment, after 12 weeks, and again 1 year later. So, which treatment worked better? Surprisingly, both treatments worked really well. Stress levels dropped significantly, so did anxiety and exhaustion, and those improvements stuck, even a year later. But here's the twist. CBT wasn't significantly better than GHP overall. In other words, a simple structured program focused on sleep, food, exercise, and relaxation worked nearly as well as a formal psychological therapy. That said, the study did find one key difference. For people with adjustment disorder, where stress is triggered by a specific event and causes emotional overload, CBT was more effective. It helped reduce stress, anxiety, and burnout more than the general health approach. But for people with exhaustion disorder, a long-term burnout-like condition, there was no difference between the two. Both treatments worked, but CBT didn't offer extra benefits. So what does this mean? It tells us that simple interventions, when structured and supported, can be powerful. Just having a weekly check-in, a plan to follow, and the belief that you're doing something to get better can go a long way. But it also shows that one size doesn't fit all. Some people, especially those dealing with recent overwhelming stress, may need the more targeted techniques that CBT provides. The takeaway? Online treatment works, and that's huge. We can now reach people with stress-related mental health problems efficiently, affordably, and at scale. And while fancy techniques are useful, sometimes consistent support, helpful habits, and structure are enough to start healing.